I need my glasses to dry because if not, somebody's gonna get hit. Good morning, y'all. It is Monday, a brand new day, officially week 5 of nursing school. I just finished my medication math test. I did pretty well. It was 20 questions and we got 40 minutes to do it. So I turned it in and stepped out. Once we're all finished with the test, we're going to be tested on the physical assessment, head to toe physical assessment, and putting restraints on patients. So hopefully I pass those 2 today and get those checked off my skills checkoff list. And then we're gonna go into administering medications, the different methods. Then we're gonna learn all the different methods and the protocols to giving meds, especially because we are going to the hospital and we will be passing meds. So we wanna make sure, I guess they wanna make sure that we're like A1, we know everything and anything about being able to give medications. But I just wanted to update you guys. It was a pretty good test. I think I got a passing grade. We had to get 85% or higher, and it was 20 questions. So I'll let you know what I got on it, but I just wanted to update you guys and start off the vlog.
I didn't fail.
No. So right there, we can see everything.
Okay. So I'm gonna ask you why you are here. This is long from the hospital.
Go to your physician. Oh my God, I know you're not serious, but they don't do that. IV tubing. This is your IV solution. This is tubing. It's coming in a pack of IV fluid clean. So you can see it has albumin, bicarb drip, a blood product. If you have theta added, you can hit enter and it'll move it down. If you hit this one, it'll switch the same thing. So it's what you want to do. Volume. If you're hanging continuous IV fluid at 100 an hour to run for the next 24 hours, you have a whole liter bag, right? You have 1,000 mLs in here. Okay? So we're going to say there's 400 in that bag. Squeeze this, and they'll get the fluid in, and that'll start planing. In order to plane your line, this has to be plane, the line and the fluid to go through. This roller plant has to be up. You can see, normally this would be air coming out. Okay? Normally this is all filled with air. To connect to, if they have multiple things going in, you can connect to that part. Okay?
Morning, my darlings. It is Wednesday, a brand new day. I am so blessed to have woken up this morning. I am going to shower, get ready, eat something, and then head over to my desk by 8:45 to be able to get this lecture today. We're learning about perfusion, so this should be interesting. And then after that, I will be going to campus from 11:30 to maybe 3:30 to practice the skills I learned last Monday again, because I'm already being tested on it Monday and Tuesday of next week. So everything we're learning, it's like learn, test, and then I have an exam on Wednesday of next week on week 6. So I'm already 2 exams in almost, and I'm already being tested on a bunch of skills. Like, it's really starting to pick up, so I need to stay on it. But stay tuned, y'all. The grind continues. just finished my lecture. It was a great lecture. We went over perfusion and a bunch of things that affect heart disease, stroke, high blood pressure. We did a case study. It was really good. Not too much information, but pretty straightforward. So now I'm gonna head to campus to work on all of the skills that I have to be tested on next week. I already packed my backpack. I'm like, it's time to go. I put all my G2 pens in this pencil case because I like to take notes while I'm there working on my skills. And I love color-coded notes. I need my glasses to dry because if not, somebody's gonna get hit. I'm literally blind when it comes to driving. So mask, everything's ready to go. And yeah, I just wanted to update y'all. See ya. y'all, I just finished working in the skills lab, so I did work on some new skills in addition to the ones I worked on last week. Some of those were like putting in Foley catheter for male and female, dressing a wound on this little fake wound dummy that we have, and priming a IV fluid. So that's getting that bag of fluids ready to be inserted for a patient. So those were all pretty good. I studied some of the different syringes you could use for different injections, and collabed with got together with some of my classmates to just go over a couple things that we have due soon. So it was pretty thick. I'm going to go to Buffalo Wild Wings and eat some food. That's pretty much what I'm gonna do, but it's been a pretty long day. I am a little bit drained, but I do still have things to do tonight, so that ain't gonna stop me. And yeah. I just wanted to show you guys kind of how I organize my studying and reviewing after we've already went over the PowerPoint and lecture. I basically have the PowerPoint out and then the outline. I'll go through the outline and use my pens, and just like whatever's on the PowerPoint, I'll make sure that I mark it on the outline. So use my G2 pens. I'll have the PowerPoint open, so each PowerPoint, or like usually in the chapters of the book, there's like learning objectives, like things they want you to take away from that chapter. So for this one, it's describing the stages of the nursing process and their application to nursing, and discussing the purpose of conceptual framework. So those are the two objectives, and then I'll go ahead and use the outline. Stages of the nursing process. In this outline, it has it overviewing the nursing process, and I'll just use certain colors to kind of underline the bold and just reread and focus on what's the most important. And I'll flip through this as I go. So nursing process, and then there's stages. So assessment, diagnosis, planning, implementation, and evaluation. So right here, I then change colors. So I'll use like green and focus on assessment. So like on here, I'll put a little asterisk. So I know that green correlates with green on this outline. Basically keep doing that until I go through everything.
We're looking at their circulatory, their perfusion, we're making sure they're not getting an infection. But they can also come in for another reason, and then we discover they have a pressure ulcer. Right? You gotta be treating the whole patient on a wound care nurse, because they are in high demand. Okay, they are. My med surg teacher was a wound care nurse, and I got to shadow her at work once.
Hey y'all, it's Thursday night. I've just been studying for both lecture and clinical, so I've been doing a lot of lecture, the PowerPoints, those outlines, the different chapters, and over here on my bed I have all the checkoff lists and a whiteboard with some expo markers, and I'm also utilizing my mirror. So I've been practicing on my mirror, just putting the list of stuff that are on those checkoff lists. So basically that's what I'm going to be doing for the rest of this week and this weekend. I'm trying to split my time evenly because I have so many tests back to back, Monday, Tuesday, and Wednesday of next week. So I'm going to go ahead and switch out the paper so that it's ready for next week's topics for lecture after the exam. Week 6 is cognition, emergencies, and diversity. And basically this is going to be replaced with week 5, and week 5 will go in front of the week 5 PowerPoint. Okay, so this is week 4. As you can see, I have a pattern going on. Oxygenation is behind it. And then this week I had perfusion, which was this one, and then tissue integrity. So these are the readings for it and the learning objectives. So I'll go ahead and put that in front. And for this exam, I'm just basically, everything that's in this section is what I have to go over for the exam. So as you can see, it is thick, thick, thick. So I'm gonna just go in order and basically go through everything. And I'll most likely start from the back because that is what I learned the farthest, like 2 or 3 weeks ago. So I'll probably start from clinical reasoning and judgment, do those, and then move my way all the way up to this most recent week. But thank you guys so much for watching and for continuing my journey with me and keeping up with Kiara. I need to stop saying that. But seriously, thank you guys so much for commenting and being so supportive and, you know, giving feedback. I truly appreciate it, and I'm just gonna basically use the rest of this weekend to work my butt off, study, and I'll keep you guys updated for week number 6. I can't believe it's already week 6 next week. I'll definitely make a vlog next week, and it'll be all about my skills that I got tested on and my second exam. I can't believe it's already the second exam, but thank you guys so much for watching, and I will see you guys in my next one. So I got my mom a gift on her lovely birthday.
Thank you.
You're welcome.
I'm gonna need that knife, huh?
No. Do you need it? Be careful now. Maybe you do. Just rip it. Be very careful with it.
What is it? Okay, let's see. Can I eat it?
Yes.
That's
Take
what I
off the plastic first, all of it off.
Okay.
Make sure nothing's around.
Instructions.
And then you want to pull it off as quickly as you can.
Pull this off?
Yeah. Yeah.
Thank you.
Yeah, I got it. Yeah. Happy birthday, Ma.
Thank you. Yes. I'm like, wait, what's
It's
on
a
that
carrot
plate?
cake.
Oh, these are nice. Oh, you took this picture
Yeah.
of us.
And a little carrot
Oh,
cake.
carrot cake.
You
Yes,
do like
yes,
it, right?
Yes.
I love you.
Thank you. Oh, that's nice.
What, did you get surprised?
Yes. Happy birthday to you. That's cute. I haven't seen it. Oh my goodness.